The need to raise awareness and find possible approach to dealing with the situation of cancer infection and spread was part of the issues discussed at the conference. The wife of the president, Aisha Buhari, urged stakeholders in the health sector to enhance cancer management services across the country. She was represented by wife of Chief of Army Staff, Omar Buratai.
We can only make significant progress in the fight against cancer through concerted efforts and actions by all stakeholders. Through my Future Assured initiative, I have provided breast and cervical cancer screening services to more than 20,000 women from across the 6 geopolitical zones.
Minister of Health Isaac Adewale, who was also represented by the Director, Hospital Services in the ministry, Wapada Balami, spoke on plans by the government to establish cancer screening centers in all states of the Federation.
The Federal Ministry of Health is working with the World Health Organization to implement the cervical cancer screening scale-up project, where screening cancer will be established in all the states of the Federation to be located in local governments areas, as we intend to house the screening activity in primary health clinics. These clinics will have referral linkages with proximal secondary healthcare facilities, which will also be linked with regional tertiary healthcare institutions for patients that will require advanced management of diagnosis of cancer cases upon screening.
The experts also identified ignorance as a contributing factor in cancer spread. They want the federal government to make active its plan to revitalize the primary health centers across the country, as this, they say, would increase adequate access to health care.
So under the program of this federal government, and we believe that it's going to be translated into reality, the federal government wants to ensure that at least every ward in every state of the country have at least one focal functional primary health care center providing 24/7 services. Now, when this is operationalized, our people at the rural area will now have access to the primary health care centers, and all of these services, because it's going to be a comprehensive health system strengthening program, will now be accessible, be it cancer care, hypertensive care, women and children illnesses, communications, all services will now be accessible and integrated at the primary health care system.
Nigerians were also urged to contribute their quota in making the fight against cancer a success. Chinomso Amadi, PTV News, Abuja.